Hi everyone. Welcome to the Carson Kids General Therapy Series. Today, we will be learning about compensation and adaptation and how your child's therapist may use compensatory or adaptive strategies with your little one. We will be talking about compensation, adaptation, and how your child's therapist may use these strategies when treating your child. Compensation and adaptation sound complicated, but they are quite easy to understand because they are techniques to make things easier. When we compensate, we might use tools to make an activity easier. For example, if a child struggles to hold their pencil, their therapist might recommend a special pencil gripping tool. A child who struggles to button their coat may be given a button hook so they can dress themselves. Compensatory strategies offer a new way to approach a task or situation. This is something a therapist may implement during a session for your little one to carry over at home or at school. Adaptation is similar to compensation because it makes things easier to do. Instead of using tools, though, your child's therapist might adapt what needs to be done to make it easier. For those of you who play video games, it's a lot like learning to play a new game on easy before moving up to the more difficult levels. For instance, a child might use wet wipes instead of toilet paper to clean themselves. This way, they don't have to reach for the toilet paper, measure it, rip it, and then use it. Instead, they have an easier time pulling out a wet wipe, which is also easier for them to clean themselves than a dry tissue. A child who is unable to write notes fast enough might benefit from typing on a computer instead. These strategies change what needs to be done to make it easier for your child to accomplish. Therapists use compensation and adaptation in practice to offer a new way to meet your little one's goals and milestones. Compensatory strategies can be used for a variety of tasks, from helping your child dress, communicate, with mobility, or can even be used to provide them visual reminders. Therapists use compensatory strategies or adapt to your child's individual situation so that they can be as functional and independent as possible. For example, a child who is nonverbal may be provided an AAC, or an augmentative and alternative communication device, so that they are able to independently express their wants and needs. Therapists use adaptation or compensation strategies in treatment by making changes to your little one's environment by addressing their unique and individualized goals. Goals help to mark progression throughout your child's development. An example of this could be using a wiggle seat during class time for our little ones who have difficulty sitting still, or using a wide rubber grip on a pencil when writing to assist with their grasp. To quickly review, therapists adapt or use compensation strategies to encourage our kiddos to meet their goals by improving their functional performance in everyday life. Compensation strategies offer a new way for our children to be functional with the things they need and want to do in their life. Thank you so much for watching. If you have questions or concerns, we would love to hear from you. As always, these videos are not a substitute for medical care. Please, always seek the advice of your medical team before implementing any of the strategies discussed here. Until next time.